Good afternoon. Indeed, it's a great opportunity for us to meet once again in order to continue from where we stop and diving into another and interesting topic. So far from our previous discussion we heard, and the one I paused, I believe, um, if I'm not mistaken, I talked about diabetes in general. But today I'm going to be talking about diabetes mellitus because many people have this problem, but many of them they don't know that they have this problem, and that is why I decided to talk about this diabetes mellitus. All right, now many people can ask, what is this diabetes mellitus? Okay, so diabetes mellitus is not just, but it's chronic and metabolic disorders, characterized by a high blood sugar levels due to some defects in insulin production and insulin action, or both the two. Okay, now insulin is a hormone that actually regulates a blood glucose level. Now, you see, what can cause all this diabetes mellitus? Many people have asked me this question, and that is why I said, let me just talk about all this topic, diabetes mellitus in general. Okay, so what can cause this? Diabetes mellitus includes several types. It's based on the types and the definition, because I want to define them based on the types and causes of this. You see, this type, the causes can be three. That is, let me talk about them. I will talk on these three causes, which we have. Number one, type 1 diabetes, because this is an uh, autoimmune condition where the body attacks the insulin producing cells, because it's the body, is the immune system that attacks it. So, and the second one is the diabetes, that is the type 2 diabetes. Type 2 diabetes mellitus, you know, is a this is an insulin resistance and inadequate insulin production, often linked to lifestyle factors. Okay, and the third one could be a gestational, or is a gestational diabetes mellitus, which occurs during pregnancy due to a hormonal changes, because the hormones changes during pregnancy, and it will result in this diabetes mellitus. Then this will actually help, most especially the students or those that are undergraduate or that are still studying. That is based on the biological action of this diabetes mellitus. Because see, in this biological action of it, the insulin helps the glucose enter the cells for energy. In diabetes, glucose build up in the blood, leading to hyperglycemia, because this hyperglycemia has to do with the high level of glucose in the blood. And over time, high blood sugar can damage blood vessels, nerves, and the organs. Okay, but and how can you know, or how will you identify that this person have this problem, or my neighbor has this problem, or I in particular am suffering from this problem and I don't know? That is the sign and symptoms of this. There will be a frequent urination, frequent urination and excessive thirst and weight loss, fatigue, blurred vision, and slow healing of wounds. All those things, all those signs and symptoms are, and an indication that there is a problem somewhere. And it could be this particular topic that I'm treating, that is diabetes mellitus. Okay. Then what would be the proper way of managing or treating this diabetes mellitus? Number one is medication. For you to manage it, we have to use some medication, such as the insulin therapy for type 1 and advanced type 2. And so also the oral medication like the metformin. And the lifestyle changes actually play a vital role in treating or managing this diabetes mellitus. Because what would be the lifestyle changes, like exercising yourself, having some healthy diet, managing your weight will actually help a lot. Those are the lifestyle changes. And so also monitor by regular blood sugar checks, and all these HbA1c tests will actually help in order, because once you are checking yourself the level of your sugar or the level of the sugar in the blood, you'll be able to have some some counsel on what to do and on what not to do. And prevention is better than cure. What will be the preventive measures of this diabetes mellitus? Because maintaining a healthy weight, eat balanced diet, exercise regularly, avoid smoking and excessive alcohol consumption will help a lot in preventing yourself from this problem. And I have a good news by giving you some advice. Please educate yourself about diabetes management. As you are, as you are watching, you are learning. Okay, so also you can have your personal doctor or someone that can at least educate you more concerning this. And that is why I used to give a room for a comment. Any question, you can just put it at the comment section. I will get back to you and I will reply you, answer your question to your own satisfaction, God's willing. And so also stick to your treatment plan and monitor your blood sugar regularly. Don't be saying that, no, 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 I'm too tired of taking all these drugs. No, 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 no. If the sickness is not tired, you don't need to be tired too. So, checking yourself regularly and continue to monitor the drugs that you are taking is very, very vital. And also seek for a support from a healthcare providers and diabetes support individual or groups. That will also help or will also go in line with managing and treating this diabetes mellitus. Thank you very much. Please just feel free. Any question that you have, put it at the comment section. And by the special grace of God, I will get back to you. I'll reply you to your satisfaction. Thank you.